I'd like to welcome everyone to this episode of the System Podcast. And today we'll be talking about Heart and Soul, the journey of a Cardio Thoracic Surgeon. And our guest today is Prof. Jameel. He's a cardiovascular and thoracic surgeon working at Aminu Kano Teaching Hospital and a professor of surgery at Bayero University Kano, Nigeria, and a healthcare entrepreneur in areas of digital healthcare, media, and business consulting. He has interest in adult cardiac surgery, minimal access cardiovascular and thoracic surgery, surgery education, and healthcare entrepreneurship. So, sir, I would like to formally welcome you to this program.
Yeah, thank you very much.
Okay.
For the opportunity.
We are the one that are opportune to have you, sir. Now, the episode today is going to focus on the journey of Prof. Jameel, and which is virtually almost the same as the journey of every other cardiothoracic surgeon, and some of the challenges and success that comes with it. So the first thing I'll first come with is, so I would like you to briefly discuss your early life and what inspired you to pursue a career in medicine.
Okay, thank you very much. So, as he said, my name is Jameel Ismail Ahmad. Currently, I'm a cardio thoracic surgeon, but I come from a local government in Jigawa State, Ringim. Though my primary school, I did my different primary schools, about 5, because then my father was working in different local governments. But finally, I finished the primary school in Gaya. And then I went to Kano Foundation Secondary School for my junior secondary school. And then I proceeded to the famous Dawakin Tofa Science Secondary School. And then in 1996, we got admission into Bayero University Kano and studied medicine, graduated in 2004. So many issues then strike all over, but at the end we were successful. So I did my housemanship in Aminu Kano Teaching Hospital, and then by 2005 I proceeded for my NYC in Kwara State in Bakata Clinic in Ilorin. I stayed in Kuntu, which is in the center of Ilorin, and then afterwards, in fact, we just rested for like 2 weeks, and we started the residency program in surgery after the NYC. And we've been in the residency program since from September, I remember 4th September 2006. That's when we started. And I did the pre-part 1 program in surgery in Aminu Kano Teaching Hospital and passed the part 1 exams in 2009. And I then stayed in general surgery for 2 years, waiting for an opportunity in cardiothoracic surgery, which then the training was not very available in Nigeria. So I got an opportunity in Ghana and then proceeded in 2011 to the National Cardiothoracic Center, where I stayed from 2011 until 2013. And then I also went to India, in Gurgaon, that's in Delhi. Oh. And I spent a year at a very big hospital, Medanta. It's called Medanta Medicity. It's a 2,000-bed hospital.
Wow.
And I stayed there. Heart Institute is very big, so I stayed there for a year. And then I went back to Ghana and then did my part 2 exam. So I became a fellow of the West African College in 2014. And from there, I came back. And from then, I've been as a cardio thoracic surgeon with Aminu Kano Teaching Hospital and lecturer with Bayero University Kano in surgery department.
Wow, that's very great, sir. Very interesting journey.
Yep.
Sir, what are some of your influences and experiences that led to your interest in cardiothoracic surgery? Because I was checking the internet earlier before I come, and I saw a research in PubMed that showed that they use 618 surgical trainees, and only 10.7% choose to pursue cardiothoracic surgery after their part 1. So, sir, there are definitely very few people are choosing it. So, what was your own interest and influence?
Okay, so maybe before going to that, initially we were saying what inspired me even to study medicine. Yes, well, I had interest in healthcare, but then in secondary school I got a bit confused with three things. I was interested in medicine, interested in business, and then interested in media. Wow. Those are three things. And then later, maybe when we discuss, I don't know, but now they're getting coalesced into something. So I had interest in...
We have it part of the discussion.
Yeah, so I had interest in medicine right from even before the secondary school, because I was a health prefect in primary school, and I developed that interest. And I think I was also further supported and motivated by my father, who was also pushing me to that. And alhamdulillah, there is no regret at all for that. Now, coming to this question, yes, currently there is decreasing interest and motivation in going for cardio thoracic surgery among surgical residents and sometimes even medical students. It may have to do with so many factors. First, maybe because it's a bit difficult. It takes some time to do that. Yeah. And then it also demands you to always be in the hospital. And even after qualifying as a fellow, some cases, they take a long time and the patients are very critical. They'll be in the ICU. You have to be there. And then now the younger generation also, everybody is looking for how to make money quickly. Yes. And that one, it takes a lot of your time and a lot of your life. So maybe that is also contributing to that.
But you said many people are kind of looking for how to make money quickly. That's true, but there's something about making money personally. Everybody wants to make money, but people don't realize that you cannot make money fast.
Yeah. So that's another problem, because a lot of people are confused when you, especially the younger ones, when you read some of the motivational speakers. Yes. And they will tell you that so many people became rich in their 20s because they go into IT, they go into this. But if you critically look at it, most of the people who became rich were maybe after 40 years, around 50. Yeah. But before 40, you are just trying to really develop yourself. Only some few people really, either because they were very lucky, they've worked hard, or they inherited money from their parents.
And I think, sir, even those few people, let's say something like, for example, Mark Zuckerberg, who is now on Facebook. Yeah. If you check his life, he has been working towards tech. Yeah. From very young age. And if you bring it together, yes, he has spent almost more than 10 years.
So that's one of the problems. So, but usually there are no shortcuts. Yes. To success. So you have to follow the process. Otherwise, it may not be sustained, because you may have some huge amount of money now, and then after some time you crash and then you go down. So maybe that may also be contributory. But actually what motivated me to go into cardio thoracic surgery, essentially right from the preclinical side, I had a lot of interest in anatomy, and especially the cardiovascular anatomy, chests. So when we did the anatomy of the heart, the chest, it really fascinated me. Wow. And then the physiology was also very practical and making a lot of sense. So that was really motivated me to start thinking, maybe I can do something that is related to the heart. Mm. But what really, one of the moments that really changed my mind, and then I became really fixated on going for cardiothoracic surgery, was while we were on 400 level. I think at that time we were in pathology posting. So I was in the library, then I just saw a book. It's called The Hearts by Thomas Thompson, which is about the biography of two famous cardiothoracic surgeons who were very known for a lot of achievements. One was Michael DeBakey, and the other one was Denton Cooley. So I saw that book. I started reading it. I dropped all the anatomy, all the pathology books, and then I had to make sure I finished reading it completely. Wow. So after I finished reading, then I just became convinced that I think this is the specialty I should go for. And I decided that I'm going for cardiothoracic surgery. So right from the medical school, even some of the teachers, like I know one of my mentor who has mentored me in a lot of things, Professor Sana Alasa. Okay. Yes, even from medical school, he knew that I said I'm going to do cardiothoracic surgery. So even during a housemanship, once he see anything thoracic or cardiac, you call me. That come, let's do something on that. So that was really what motivated me initially.
That's great motivation, sir. Now, we actually talk about some of your experiences in school, and so I would like you to briefly describe the training process for the cardiothoracic surgeon, including the residency. And the residency is most important. The fellowship is later, since the medical student, the first step is the residency. And also I saw, now I don't know, you said it's kind of hectic, but I'm thinking, shouldn't it be becoming easier since there's a tech boom in the field of cardiothoracic surgery, though in Nigeria it's kind of little. So how is the training relation?
So maybe let me talk about the training, especially in the context of in the Nigerian or West African context. So once you graduate as a medical doctor from the medical school, of course, you do housemanship 1 year. And then in Nigeria, you have to go for NYC.
Yes.
But in other countries, you may not have to do that. And then so once you qualify to join the residency program, usually by passing an entry exams, which is in most places is called the primary exam. So when you pass, then you become a surgical resident or a resident in surgery. Now you started the junior residency. You go through all the major surgical units where you're going to spend some time to rotate among those units, and then you spend at least 2.5 to 3 years. By that time, you have done all your rotations, you have fulfilled all the criteria, and then you register for the next exam. And the next exam is the Part 1 exams. So after the Part 1 exams, now there are some changes. When you do the Part 1 exams, like in the West African College of Surgeons, then you have the membership. But national, I think, is still not there. So when we did our own, there was no membership. So once you pass the Part 1, now you become a senior registrar. Now, as a senior registrar, then that is when you will actually decide on a specialty in surgery. So if you want to do cardiothoracic surgery, then you find a place where they have accreditation for residency in cardiothoracic surgery, and then you start. And you take at least also another 3 to 4 years to complete that one, because you have to do about 2 years in thoracic surgery, 1 year in cardiac, and then 6 months in vascular, and then about 3 months each in adult, and 3 months each in adult and pediatric cardiology, and then some months also in radiology and some critical care. So you take at least 3 to 4 years to complete that one, but it depends on the center. Sometimes, in most instances, because most of our centers don't have full accreditation, because open heart surgery is not regular in many centers. So you realize that one has to go to many centers to do the postings. You see, like currently, some of my senior registrars, they've spent 2 years here. Someone has gone to Lagos for some thoracic posting. Now he's in India for a year. Then I have another one going to Senegal. They have a heart center also there, and then he will have to go elsewhere. Somebody is going to Sokoto, and then will also go to either Senegal or Morocco or Algeria. So depending. So that's how it happens. So after 4 years, you've done all the postings, you have qualified for the exams, then you go for the Part 2 exams. And then when you pass the Part 2 exams, then you become a fellow depending on the college you are pursuing. You can become a fellow of the West African College of Surgeons, that is FWACS, or you become a fellow of the National Postgraduate Medical College, FMCS. So that is what happens. But in other climes, it may differ, the training may differ, because in some places they have an integrated training program, where once you start the residency, you're just starting in cardio thoracic surgery residency. So it's only from the cardiothoracic unit that they'll be sending you to do appropriate postings.
Okay.
Yeah, so they have integrated. And now a lot of changes have happened. In fact, now you even have residencies in thoracic surgery alone without cardiac. Like in India, they do a lot of that. I had some friends who have done that.
So if I understand, it just depends on the particular center you are and the availability of the things.
Yes, depending on not really the center itself, but depending on the region and the college.
Oh.
For example, some difference maybe there between the West African College, sometimes even the East African College. Sometimes when you go to Asia, when you go to America, you go to UK or other places. Because there are some, they only do cardiac surgery residency. They don't do anything thoracic. While there are some that pursue only thoracic. You understand? While in here we do the cardiothoracic. both of them.
So I thank you for that. You have really clarified so many misconceptions we are having. Now, the next thing, sir, do you actually talk about them in a way, but I would like you to clearly differentiate the residency in, most people now would say they want to go out like US, UK. So how easy is it to get to do residency there? And what is the difference between that of UK, US, and here in Africa?
Okay, so essentially the final outcome is the same. You become a fellow of the different colleges. That's the final outcome, but the entry may differ. Even here, sometimes you realize maybe there are not enough placements for the residency, but in here, I told you how it happens. But if you're going to other countries, the US, the UK, there are different exams you may have to do so that you qualify, and then you have to be matched depending on the availability. Because elsewhere, they are well organized, so they really plan how many spots or how many placements they have for different specialties.
Yes.
And then, of course, there are also national interests. So they look at that, and then if there are spaces, and then you've qualified, because you have to compete with many other people. And if you qualified and there are spaces, then you can get absorbed. But sometimes things may not be easy. But even here, as I said, sometimes it may not really be easy. But the most important is just understanding the steps and then getting a mentorship from maybe somebody who, if you go into the UK, you have a Cardio Thoracic Surgeon in UK, and you get a connection with him, he'll guide you appropriately. Or even a resident there, if you go into the US, the same thing, instead of just maybe going without really blindly, yes. But as I said, there are also national interests. There are competitions. You have to compete against many other people who are coming from different other parts of the world. Yes, so it is there. It may not be as easy, but once you are focused and you have the passion, and then with a lot of luck also, then you can find things will be easy for you.
This statement you said about luck, it reminds me of a book I read, which they call it Unfair Advantage.
Yeah.
And they say one of the 5 unfair advantage, which you might have one part of them, but most of the things, those are the things that determine how much somebody will go for.
Yeah.
I said the first one is money. The next is intelligence. The next one is luck or location. The next one is experience. And the last one is status.
Yeah.
And when you say the luck, it's very much important.
Yeah, sure.
So, sir, you've been talking about the hardship in cardiothoracic surgery training. Now, sir, what are the strategies that you can advise somebody to kind of start building from now, who have a plan to study this course, to be able to be resilient?
So actually, when I talk about the hardship, someone may think, oh, this man is trying to scare us away. No, I'm just trying to say some of the reasons why. But once you are interested in something, I have the passion. While people are saying that it's very hard, but in yourself, you are just happy pursuing a dream.
Yeah.
And I remembered in Hausa, there is a proverb that said, Saka yafubotachiu. Yes. So usually if you really want to do something, you're interested in doing something, you won't feel it. But at least the first thing is you need to know the steps to take. And the Cardio Thoracic surgeons, they are humans.
Yeah.
Yeah. So they just got trained. And once you are resilient, you can get it. And virtually everything in life is not as easy as people think. Yes, because usually we like to follow the path of this resistance, but doesn't almost in many places it doesn't work. So whatever you're doing, even if you're going to study the most simplest course you think is simple, if you want to excel in it, you have to really sacrifice a lot and you have to be resilient. So, but some of the things you need to do is always believe in, there is this book by Stephen Covey, The 7 Habits of Highly Effective People. So one of the habits is begin with the end. So begin with the end. Begin with the end is that you need to sit down and say, okay, in the next 5, 10 years, 20 years, what do I want to become? That's the end. Now, when you have that idea or then you sit down and look at it, okay, what are the ingredients I need to achieve that? And then you look at the ingredients and then you follow them. And you already have a target that in 10 years, I want to be this. It's just like when you want to build a house. First of all, when you have the land, you have the concept, you have to really put the concept, get an architect, you put it into a drawing. And then now with even so many softwares, you can have the 3D image of the house with some trees around, with beautiful cars that you may be able to buy. Yes, but you put them there so that you're looking at the end. And then you sit down and say, okay, now for me to build this house, I need to get a land. Then you have to get a land. I need to also get some quotations, the bill of quantity from different engineers and all that. Then you do that also. And then, okay, how much do I need in terms of resources, in terms of money, in terms of cement, in terms of everything? And then when you have that, the labor, and then you start building gradually until when you reach there. So if there's something with life, don't start to first. No. Begin with the end that I want to be a cardio thoracic surgeon in 10 years. I want to be a professor in 20 years. I want to be a Dangote in 30 years. You understand? So then you start building on how to reach there. So a lot of things now are better because information is much easier to get now.
Yeah.
Apart from that, even the training has improved. Before, you must be there physically, like in the theater, for you to learn something. But now there are so many improvements in surgical education. Virtual reality simulators are there. So you can actually, and then the high fidelity, they've been tested, and they can actually convert the skills you've learned to the real life skills in the theater. So a lot of things have changed, but again, now there are a lot of distractions.
Yeah.
So that's another process. So that is what is diluting the advantages. So you get distracted, you want to do everything.
I think there's always a collateral damage.
So usually you realize it's still the balance that is maintained, but there are opportunities now so that you can listen, you learn better, and now before you have to read a lot of things, but now you can have an audio version of anything.
Yeah.
You can just be relaxing and then you be listening, and it's just like you are reading as well. And then you have graphics, you have YouTube channels on everything. So it's much, to me, it's much easier now. So far, one is focused and you can be resilient. And one thing especially for the younger ones, when you are now you're in medical school, you realize there are differences socioeconomically between members of the class. Yes. Some are from rich families, some are from poor, some are from middle class. You understand? But after you graduate, by 10 years, everything balance. And then you realize everybody is almost moving at the same frequency. Now, after another 10 years, then you realize actually, even those from the lower background, because now it relies only on your opportunities, on your capacity, on your networking and what have you. So you realize even those from the lower socioeconomic background, now they've moved to the top level. Yes. And then you realize also at that point in time, virtually everybody has the same thing.
Yes.
Maybe most of you, if not all, are married. Everybody has a car.
Yeah.
Everybody maybe has a house. Everybody has children.
And virtually everybody can.
Yes. And then by the time you retire, then all this money, it may not have much meaning.
Yeah.
Because then you cannot. So just decide on what you want to do. Don't be distracted, be focused, and then you pursue it. Happiness is not about money only.
Okay.
Money is good, but sometimes a lot of very rich people are not happy.
Yes.
You understand? So yes, money is good and you have to look for it, but happiness, there are so many things that define happiness, and a lot of studies have been done. So be focused, do something that it will make you happy. Your personal happiness is more important than any other thing.
Thank you very much for that, sir. Now, sir, most of us have been looking up to you. You have achieved so many things, but actually, it's vague. So many people don't really do. So this is a form of motivation to us and the younger ones. In form of, if you can highlight some of the achievements which cardiothoracic surgery have exposed you to, which you are so much grateful about.
So some of the opportunities that cardiothoracic has exposed, one, even to explore many parts of the world and to create a lot of networks and see what people are doing and then engaging. So that is one opportunity that it has provided for me. Another one is it has also taught me a lot of discipline, understand discipline, and then resilience as well. I remembered always when people complain, some people complain the calls are too much. So I said there were times that was a time I was on call for like 2 weeks in a center in Ghana, and I stayed there. In fact, I was not going home. I would just stay there. I order for my food, everything. So, but it has all passed. You understand? So, but the discipline also, because in some places there are places when you start your activity by around 7 a.m. You have to go and do a ward round by 7 a.m., the whole team. Then after the ward rounds, around 7:45, then you go for morning meetings where all the patients will be presented in the center. And the morning meeting, you have everybody, the cardio thoracic surgeons, the cardiologists, adult pediatrics, the anesthetists, everybody, pharmacists, everyone is there. And then after that, immediately around 9, then most people will go to the theater and start operating. And then 1 or 2 people will come to the ward and do a proper ward round. Once they finish, they'll also join the theaters. And then we have our laboratory, everything in one place. And then the lab, they will come and take all the samples you request, x-rays, echo, everything. Now, by the time you finish the theater around 5, you'll all come down again for another rounds. So you do a round by 5, you finish around 7. So hardly do you miss any problem for the patients. And you do that from Monday to Friday. And on Saturday, you have to also do 2 rounds, Monday morning rounds and evening. And on Sunday, you have to also do an evening rounds. So with that, everybody knows about all the patients. And that was the same philosophy and the same culture we tried to bring in when we started working on starting or establishing a heart center in the Aminu Kano Teaching Hospital. And now hopefully by the end of this year or beginning of next year, the center will be ready, a standalone center with all the facilities that you don't need to go out of the center to get all those things. So those are the opportunities it has really provided for me. But more so, the other opportunities is seeing patients who are really desperate, vulnerable, and they don't have anywhere to go. And now they're coming before they have to go to other countries or other centers in Nigeria. And now they can easily come to you, and then you offer them the appropriate treatment and they get better and they are grateful. So that is really what is coming, and then it really says a lot. So that is a very big opportunity because you're solving somebody's problem and then he gets it easy. So those are some of the opportunities I got from Cardio Thoracic Surgeon.
Now, sir, the recently concluded GITEX Africa that you attended, sir, how did it shape your experience and your professional growth, sir?
Okay, so maybe to give a background, well, I'm a cardio thoracic surgeon, but ab initio, I told you while I was in secondary school, I was interested in business and entrepreneurship. So even while I was a senior registrar in Ghana, almost a role in a Masters of Business Administration from, I think, Liverpool or another university, I forgot now. But then I didn't have enough money to pay. So I just left it. But I've been interested in that. And later I did the MBA, a Masters of Business Administration, specialization in entrepreneurship and venture creation. Yeah, so from then on, despite the pursuing cardiothoracic, I've really been engaged in a lot of entrepreneurship stuffs. So part of it was about 2-3 years ago, there was this center in Bayero University Kano, which is located in Aminu Kano Teaching Hospital, Africa Center of Excellence for Population Health and Policy, SFAP, yes, which is World Bank supported. So World Bank requested that each center should start a program on entrepreneurship and innovation in their own thematic area. And the thematic area is population health. So I was invited and we developed the request for the application for the grant, and we got a small grant and we started. So I am currently leading the Healthcare Entrepreneurship Innovation Program of ESPA. Yes, so then that was how we organize programs. In fact, last year we organized a program on pitching event where many people came with ideas, and we even gave them some startup grants. We did boot camp for healthcare entrepreneurship. We did training on IP, that is intellectual property and innovation. We also did some other things. Now we're coming up with a hub, a healthcare innovation entrepreneurship hub, in the center. And about 2 weeks ago, we were even at NIDDA. NIDDA is National Institute for Technology, National Information Technology Development Agency. Yeah, NIDDA. So we're there for some partnership and collaboration for many things. So I was there, and then I actually went to GITEX. The GITEX is a global information technology exhibition, which was started in 1981 in Dubai. But now the GITEX Africa was started last year in Morocco, Marrakesh. So this is the second edition, and I attended that. Many people attended, all the brands of IT, especially also the new session on healthcare IT was started, which is called the World Future Health Africa, was started this year. So essentially that was I attended, I networked, and then created a lot of collaboration. And now we're really going to do a lot in terms of nurturing and mentoring younger ones, so that with the hub, then we'll have incubation programs where new startups can come up and then they'll be incubated. And then we'll also have accelerator programs for other a bit more advanced. So that's why that was essentially why I went to GITEX Africa, and hopefully we're going to have a lot of things. And my hope is that it will be a hub both for undergraduate, postgraduate students, and the innovators from all over, around outside the university system. And so that was essentially, and because I also had background in digital health. Yeah, so when I saw it part of so when I went, I also I got a lot of collaboration on that, on digital health. And we hope with the collaboration, we may even have a digital health simulation center, so that even undergraduate students, postgraduate students, they will all pass through the training, so that once they come, because the technology is the future.
Changing the whole thing now.
Yeah.
Wow, that's a great achievement, sir. Now, sir, another important thing, it's about the work-life balance. With this profession and many other stuff that you are heading, so how do you manage this work-life balance of a thing, sir?
Okay. Yeah, so work-life balance is important, because even for one's sanity is very important. And then you also have your social responsibilities and obligations that you need to do. So I think the work-life balance is trying to create a quality time for all the aspects of your life, apart from the work, the social life, your family, friends, and all that. But importantly, also trying to delegate responsibilities and supervise. Some of those things we're talking about, there are so many people on the background. Okay, if you look like, if you're going to use the IT concepts, you have the front end and you have the back end.
Back end, yeah.
Yes. So there are so many people at the back end that do a lot of things, and you manage, you supervise, you understand. If you say you're going to do everything, it's not human for you to do that. So that aspect, and then by that you are also training others, so that even if you are not there, a lot of things can be done. So that is the managerial aspect of it, and it really helped me to do a lot of things, because when you have younger ones, they're also excited to explore. And they have also new ideas, and you listen to them and then you take it up. So those are the key things. You need to focus and be organized, that, okay, these are the things I want to do. And then you put time for everything, and then you delegate responsibilities and supervise. You understand? So those are really the things. But work-life balance is important, because when you do that, and then sometimes you may have a deadline on something. So when you have a deadline, you have to just focus on it and finish it. And then you compensate with quality time on other things.
I recently read there's this author that wrote a well-documented life history of Elon Musk. How much, like, some crazy deadline he used to put that in the creation of his SpaceX company. He would just put a deadline and he will make sure everybody work. Even though he doesn't have much of the skill for the tech stuff, but make them to work.
Sure. That's the key thing.
So, sir, you talk so much about the future of Cardio Thoracic Surgeon in this field, some of the collaborations you've made and all those kind of things. So how do you envision cardiothoracic surgery here? And a part of that, I want to pitch in something I saw part of your bio in LinkedIn. you said hopefully in the next 10 years, you want to partner and have a private heart center. So I know it will also boost the field of cardiothoracic surgeon. So how do you see, what do you foresee for it?
Okay, so first, cardiothoracic surgery has a great role and it has a lot of potential, because currently about 1/3 of all mortalities in the world are because of cardiovascular diseases all over the world, and about almost 18.5 million people die every year because of cardiovascular disease, and a lot of these deaths also occur in developing countries. Unfortunately, the developing countries are also the places where there are no enough services to even diagnose, to treat, and then to follow up. So now this is a huge opportunity, because where problems are solved, then the opportunities are limited. But where you have a lot of problems, that is where you have a lot of opportunities. It may look a bit bleak, but when you compare 20 years ago and now, a lot of things have happened.
Yes.
A lot of changes have happened. Sometimes we don't really look at it because we have a lot of problems. So our minds become beclouded by all the challenges, and we don't see the subtle and dramatic changes that happen. So cardiothoracic surgery is important, because a lot of patients, like in Nigeria, according to the WHO, ideally we need to be performing about 400 open heart surgeries per million population. 400 per million population. Now, what is the population of Nigeria?
200 million plus.
So at least, even if you're now it says about 229 million, but let's be conservative and take it as 200 million. Now, if you say 200 million, 400 times 200 is how much? It's about 80,000.
Yes.
So ideally in Nigeria, we should be performing about 80,000. But again, if you're going to be very conservative and then say, okay, let's take half of that, 40,000. Now, in the whole of Nigeria, the number of open heart surgeries that are being done are less than 500 instead of 40,000. So the patients are just there, and patients are dying either because the services are not there at all, or because the people cannot afford. You understand? So if we can really come up with some models where people can be able to afford, then in fact people will be overwhelmed. So the opportunities are there, and there are some key things. One, for cardiothoracic, one is the issue of trained personnel. Now, these are key. Without training, without trained personnel, every other thing will never function. So you need to have a clear pathway and a very good intervention on really developing critical mass of trained personnel in cardiothoracic.
If I may understand, one of the problem we are facing is that there is little training.
Sure.
That's the first problem.
That's the first thing, the first problem. Because even doctors, how many do we have in Nigeria? Ideally, we should have one doctor to 600 patients. Okay. But currently now we have about only one doctor to 10,000 in urban areas, while in the rural areas is at least one doctor to 28,000 people from 600. So now we come to other specialties. Cardiothoracic in Nigeria, how many do we have? And a lot of people have even left the country because of so many issues. So we need to do a lot in really training people, even if it requires the government coming in to collaborate with some other centers in other countries, so that you massively train people on different aspects, including cardiologists, adult pediatric, the surgeons, the perfusionists, the nurses, the scrub nurses, the ICU nurses. You understand, a lot of them, biomedical engineers. So that is one. The second one is equipment. Equipment is much easier, because if you have money and you have the willingness to do that, in 3 months you can equip a center. You understand? But there has to be some dedication, and a lot of things are being done. Hopefully in the next 1-2 years, we will see a lot of changes from the government side and the private sector side. Then the other thing is the infrastructure, because you can't bring the equipment and put them in the open field. So you need to develop infrastructure also. I don't take it as a big problem. Once there is willingness and the money is there.
Yes, it goes with the money.
Goes with the money, you understand. And then another thing is the management. How is it going to be managed? Now, currently, when you look at the way things, the trajectory of things, is that most likely a lot of things will employ the public-private partnership, PPP. So we have to look at that. Are we going to run everything as entirely public, or entirely private, or public-private partnership? All of the models, they have their pros and cons. But what I advocate is that you should I advocate more of the public-private partnership and the private, because the way it is contextually in Nigeria, for a public system, the challenges are too many. And it seems the government is even tired of that. So definitely we need to, how it will be managed for it to be sustainable. Okay, then lastly, affordability. Even if you bring now minimum for open heart surgery, minimum about 5 million naira. Now, how many people can afford 5 million naira with a minimum wage of, how much is it now? 30,000.
Yes.
And the plan is to move it to 62,000. So 60,000, 62,000, how many years will you work before you get 5 million naira? So it's impossible. So we have to find a way. One issue of insurance, the health insurance have to be boosted and encouraged to do a lot in covering cardiovascular diseases and management, including the surgery. Two, we need to also have a lot of foundations and NGOs that can support that. You understand? There are many people who have a lot of money and they have foundations, but maybe because we are not talking to them in the right language, we are not communicating with them. Even in Kano, you have Dangote Foundation, you have ASR Africa, which is Abdul Samarabi Africa, and they can do a lot. ASR Africa, he has dedicated almost $100 million every year in Nigeria and Africa, other African countries, for intervention in different aspects. So if you can do that, then you can be able to, even if it is not free, but at least it will be discounted for people to be able to afford it. So I think these are key things. When those things are sorted out, because without affordability is a big problem.
Yes.
So once these things are sorted out, then the cardiothoracic will really flourish. And you see a lot of patients benefiting and a lot of even younger ones going in. Yeah. Because once you have that, you don't even have to go elsewhere for the training. You can do it here and you can just go elsewhere to get more experience, or if you want to super specialize. Because the future is that even cardiothoracic surgery, you have to super specialize. Because now people are not doing just, hey, I'm a cardiothoracic surgeon alone. No. Some people are entirely thoracic. And a lot of people in thoracic, they're going into minimal access, that is VATS, video-assisted thoracic surgery. And then in the cardiac, you have also people going into adult cardiac only. And even the adult cardiac, there are people going into valves alone. Wow. There are people going into coronary artery bypass graft. Then in congenital, people also go into many things. And there is even a hybrid one. They call them adult congenital. Somebody who is like 20, 30 years old coming with an ASD. It's a congenital problem by an adult. So you have also another newer breed of surgeons that are adult congenital cardiac surgeons. And then you have vascular aspect. So this is the future. And I think the opportunities are there. And once you have critical mass, even the stress of the work will reduce. Yeah, because but if you are just 1-2 people, so that's my focus now, to see how we can tackle at all these critical factors that I've outlined. And once you do that, then you realize, and we've started achieving some. As I said, we started this journey about 10 years ago to have a heart center with all the stakeholders in AKTH. And as it is now, the center, 4-story building, stand-alone with everything, outpatient, inpatient, the wards, ICU, coronary care, HDU, theaters. You understand the laboratories. Everything is already. So by the end of this year, hopefully it will be completed. And now there are also budgets for equipment and all that. So gradually we're achieving. So in the next 2 years, we will start using the place maybe by next year. But in the next 2 years, we will have really gotten all the requirements and even to get full accreditation for all that. So now, so these are the things. And then now I'm working on advocacy and communication. Yeah. Because last year I was selected as part of the World Heart Federation Emerging Leaders. Wow. So in Australia, Sydney, we had some trainings on digital health for cardiovascular diseases, and even had a small grant now that will soon start a study on using digital ECG for home evaluation or for home-based detection of atrial fibrillation among rheumatic heart disease patients. So we have that, and now hopefully also I may be attending the maiden edition of the World Heart Federation Leadership in Communication and Advocacy that is going to hold in Kenya, in Mombasa. So with that, we can do a lot of advocacy, a lot of communication, and then would open opportunities, hopefully, for a lot of younger ones, so that they don't have to really face the challenges we face.
Yeah.
You understand, they can be in their house, maybe from Kano, they'll stay in Kano and they'll do their residency, they train, and they can move to any other place and interact with a lot of other people. So that's my dream.
The future of cardio thoracic surgery is great.
It's great. It's bright.
So, sir, you've talked a lot about this thing, even the innovation aspect. So now, with your background in business, so this is a form of motivation to read the younger ones. So what are the importance of innovations? Like, even as a medical student, resident, like thinking of one or two, a little thing you can do. What's the importance of motivation to medical students, residents, and doctors, sir?
Okay, so innovation is key. Actually, most of the feats and the achievements in healthcare is through innovations. And innovation, one of the things that really pushed me to the issue of innovation is when you read the history of cardiothoracic surgery. It is the youngest surgical specialty. The first open heart surgery using the heart lung machine was done about 1953. So how old is it now? 1953 is just about how many years now?
It should be 70 something.
70, 71. You understand? So it's quite young when compared with all other specialties. And when you look at the heart lung machine, it's just a lot of innovation that came into being. The heart lung machine is just like an artificial heart and lungs, because we cannot operate on the heart when it is beating. So what you do is that you have to stop the heart from beating. In fact, you have to induce cardiac arrest. Stop the heart from beating.
Wow.
And then divert all the blood from the heart and the lungs into that machine. And then the machine has two functions. It has an oxygenator that performs the lung functions and give oxygen to the blood. And it also has a pump that will pump the blood back into the aorta. So now you take the blood from the superior and inferior vena cava so that it doesn't enter into the heart. You divert it to the heart lung machine, it gets oxygenated, it gets pumped, and then it is brought back to the aorta. And from the aorta, it goes to the body. It doesn't come back to the heart. So that's how you will stop the heart, divert the blood, and then you operate on the heart. You open it, you do any operation. Either there is a defect you want to close or there is a valve you want to replace. And then when you do that, gradually you have to cool the patients to about 28 degrees. In fact, there are situations where if you want to do an aortic surgery, you have to cool the patient down to about 18 degrees.
So what about
necrosis? Yeah, so at 18 degrees, because you have a lot of things you're doing, in fact, at 18 degrees, you have almost stopped metabolism.
Yeah.
And like in the around the head, you have to put some ice and all that so that all metabolism will stop. Otherwise, if the metabolism is there and then you don't have enough oxygen supply and all that, there could be necrosis and others. And then when you do finish the surgery, then you start rewarming the patient gently. So from there, you rewarm the patient until he comes back to the normal body temperature before you start going off the bypass machine. And then the patient comes back. I don't want to say comes back to life. And then he stays. So it's a high, really level of innovation. And another one is like issues of pacemaker. That is another key thing. Because pacemakers also, even though in other places, electrophysiologists, they do that, but we work together. Like here, we do the pacemakers, where patients have a complete heart block and the pacemaker is not functioning. Now there is a device which is called the pacemaker. It's a masterpiece of innovation, because that device, what it does is it has components. One component is the battery or the pulse generator. It has its circuitry there and a battery, and then you have the lead electrode. So what you do is that since the pacemaker of the patient is not working, maybe because of many problems, SA, degeneration and other factors, or there's a block, now what you do is that you put those electrodes under image guidance, you direct them through the veins, the subclavian veins, you direct them either to the right atrium or the right ventricle or the coronary sinus, depending on the type of pacing you want to do. You direct them, you push them there, you lock them there, and then you get pulse generator, and then you connect it to the lead electrodes. And then those pulse generator are placed in the subcutaneous pocket within the upper part of the chest, especially and then it becomes the pacemaker. So it will control the heart rhythm. Now with that, you set it at about 60 to 130. So it means per minute. So it means every 1 second, it will really generate the pulsation. The heart will beat because of the action of the pacemaker. And if, for example, one good thing is if, for example, you want to run because there are some issues,
yes,
or it will sense some of the problems, some of the issues, and then either by chemical or some movements, and then it will raise the heart rate, maximum up to 130. So that is also another one. Initially, it was a huge device that the patient has to be working with it, they are pushing on it. But now it's a very small device. And now, we've even gone to the extent that another one is produced, which is called leadless pacemaker. Leadless. It doesn't have lead electrode. You just you just access the femoral vein. From there, you put a catheter there, you direct it to the right atrium, to the right ventricle through the inferior vena cava. The one it is in the right ventricle, you just push the leadless pacemaker. There is one called Micra by Medtronic, which has FDA approval, and is now even they've started using in India and other places. So you just go there and you screw it into the myocardium from inside, and then that's all you come out. So these are really developments, innovations. Yes. And now there are even transcatheter insertions of valves like aortic valve. You can do that. And minimal access, robotic surgery. Robotic surgery you can do. Now, if you want to do conventionally for open heart surgery, you have to open up the whole sternum. But now with minimal access surgery, it's just one small incision you make on the side of the chest, and nobody will even know you had this surgery. And you can use either laparoscopic or you can use robotic. So now these things really motivated me to think about innovation. You can do a lot of innovation. Yes. And with innovation, a lot of things have been changed. And fortunately now we have dearth of thinking, critical thinking. How do you bring up new things? You think there is no need for innovation, but look at China. Look at even in the US, look at all the developing or developed countries. They really encourage innovation. And as I said, where you have problems, that's where you have the opportunity. So innovation doesn't mean you have to bring something extremely new and all that. Just look at a gap and then create a way to bridge that gap. Yeah. Then it becomes an innovation. Let me give you an example. Not only in cardiac surgery. Yes. We realize a lot of people in the rural areas, they don't have access to many healthcare workers. You go to a PHC, you can't even have a nurse there. You understand? If you're lucky, you have a CHU. You understand? But even their number is not much. So hardly do people have access to healthcare workers, trained healthcare workers. So now we thought of that problem and we said, and then transport of the patients. If they are sick, you usually transport them either using conventional lorries, cars, or sometimes trucks, or sometimes even on a motorcycle. Yeah. You understand? So now we thought of an idea that, okay, we have a program, we call it e-doctor. E-doctor. Now this e-doctor is a concept we brought on digital health for rural areas. So we said, okay, what can we do? We thought about it, we discussed, we've been working on it for several years, but hopefully by the next month, we're going to deploy the concept. What is that concept? The concept is we said, okay, we'll use a shipping container. We have a lot of shipping containers. Yes. Using them for shops, for many things. So we said, okay, we'll use a shipping container to prefabricate a small clinic. Just a 20-feet container. Mm-hmm. So in fact, now we've done that. We've fabricated the clinic. It has a consulting room. It has pharmacy and a lab for PHC purpose. And then we're going to use telemedicine. So in the village, we have identified a village now. We're going to deploy it into our local government by next month. And we're currently collaborating with some partners like the ESFA and then eHealth Africa. We're collaborating with them and partnering with them. We'll deploy so that we will have like a nurse there and some CHUs who will be there. And then patients will come. And then we have doctors in the city, like in Kano. And once they come, then they can be, because we will have internet service there, and they can be able to offer teleconsultation from the city. And we've concluded everything on that. And then we also prefabricated tricycle ambulance. Wow. These are the data. So So we have it now. Maybe when we go out, I'll show you. We have it one here in this center. So we fabricated one, and then we use it for medical transport. One, we can also use it for health promotion to further remote areas, and then we also use it. Another concept is home health care. Everything digital.
Everything.
You have your. So that is the concept we are piloting now, and then when we do that, then hopefully it can really transform a lot of things. You don't have to be in the village, because many people not stay in the village, even though a lot of us come from the village. But you can be anywhere. You can be in Kano, you can be in the UK, you can be in the US, and then you offer the service.
The CEO of Perplexity said something.
Yes.
He said, innovation, one of the magic of innovation is to help people to become more lazy.
Yes.
Like just let them be how they are and give them the...
Yes. So this one now is the cost of transport.
Yeah.
If somebody from that village is coming to see a doctor, at least he may spend 500, 1,000 naira.
Yes.
You understand? But there he may just come and maybe with 200 naira. He's seen.
I believe, sir, you would be the biggest health entrepreneur in this area.
Well, we're just trying. We're just trying, and we hope. But one thing, we're collaborating and partnering. Partnership is very important. You can't do everything alone.
You can't.
So these are the things we are really...
Many investors would love to invest in things like
yes.
This is what is supposed to be on ground.
Yes.
So we shouldn't just be folding on that we are doctors, like everybody have to.
We have to do a lot. And then we also, with that, we are also working on a project with the same e-doctor concept. We're working on 2 further projects. One is we want to Uberize specialist care.
Yeah.
So now, just like Uber, so we're developing an app that we're going to onboard all the hospitals, all the specialists. And if you need maybe to see a pulmonologist, you can just come there. We'll book your appointment. We can go, it depends on where he is, go and see him. But you just pay us some, just like Uber they're doing. So we're working on that as well. And soon it will come. Then lastly, we're also working on e-pharmacy.
Wow.
E-pharmacy, so that you can request for your prescribed medications. You can request virtually, and then we deliver at home.
That's great.
So these are some of the few things we're trying to work on the innovation. So all those, when you look at it, it's just looking at some of the gaps, and then, okay, what can I use technology for it to solve those problems? So you don't have to invent something completely new, but innovation, it's just looking at the gaps and then sorting out. Yes, the issues.
And if we will look at the concept of ChatGPT, which people are using very well, they did not really do something much different. When I was listening to a podcast they did about, specifically it was with the CEO of Perplexity, which is almost the same with ChatGPT.
Yeah.
He was a PhD. He's a PhD holder. So one of the things he employed into his own, which is different from ChatGPT, is that he took a lot of data, talking about 30 million data from most of the top journals. And once you just search, they will try to bring you your answers from the best journals, and it will be streamlining it. And which is not, he did not really go there and create anything, and just help you to connect.
Yeah, sure.
So, sir, in conclusion, in summary, we've talked a lot about medicine, thoracic surgery. And we've gone down to talk about business entrepreneurship, and this is a very great episode, sir. So, in 1 or 2 sentences, I'd like you to just give us your final thoughts to the audience.
Okay, so thank you. So some of the final thoughts are that in life, as I said, your personal happiness and personal fulfillments are key. And those happiness may not necessarily be monetary, though money is important, but they may not necessarily be monetary. You need to be focused. You need to also be resilient, and then always look at gaps. Where there are gaps, and then you fill it. You may not have to follow the current trends where if people take to the east, you may not have to follow the east. Sit down, look at it. What are the problems? And then you see what you can achieve. Always begin with the end. It's very important. And then cardio thoracic surgery, it has a lot of opportunities. And when you take all the different elements for establishing heart centers and cardiothoracic program, not necessarily the surgery itself. When you look at all of them, if they are really worked on, then the potentials of cardiothoracic surgery will know no bounds. And then a lot of younger ones, I advise a lot of people to develop interest in different aspects of heart care. It can be cardiothoracic surgery, it could be anesthesia, cardiothoracic anesthesia, it could be adult cardiology, pediatric cardiopulmonology, a lot of things that are there. We need to work as a team. So teamwork is very important. You need to delegate responsibilities, supervise, employ innovations, use the opportunity of the digital technology, because we're in the fourth industrial revolution and it's about information, about technology. So use that so that you solve some problems. Always look at gaps and try to solve some problems, provide solutions to some problems, and then you'll be happy. And at least the life is a bit short. Yeah. But within the short life, you can be able to achieve a lot and impact, so that even when you are not here, at least some legacies are there and other people will come and build on it. So those are some of the key takeaways I have.
Thank you very much for giving us this time, part of your busy time. We are very glad you really shared the wealth of knowledge, information. This will go a very long way to us. Thank you, sir.
Yeah, thank you, Alpha.